Welcome back to the Collender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Collender, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Collender is here with us discussing his concierge practice and how to avoid heart attack and stroke and how to begin the reversal of artery disease. Now, Dr. Collender, we've talked a lot about cardiac disease, artery disease, and then we started talking about diabetes. What can you do? Throw a bone out to the diabetic and the pre-diabetic out there. What can they do?
So, thanks, and I appreciate the opportunity to give some people more information. I want everyone out there that's been on this spectrum of insulin resistance, family history, pre-diabetic, diabetic, I want you to think of your body as a machine that needs to operate on the proper fuel. And if your body does not metabolize sugar, which is the case in people who have insulin resistance, stop putting in fuel that your body doesn't want to have. Mm-hmm. So what's our simplest sources of sugar? It's sugar, bread, pasta, bagels, refined flour products, and of course, processed foods. These are chemicals that our bodies are not engineered to work with. And when we eat these things, we further undermine how our liver processes what you eat, and we make bad lipid particles, which again gets inside your arteries, causes inflammation, which causes us to have plaque. I do want to take this opportunity to educate the diabetics who are on medication. And this is my personal vendetta because I've been treating diabetics on my own for a long time. I'm not a big endocrinology referral person because I'm comfortable treating diabetics. There's a class of drugs called sulfonylureas, and I'm sorry to throw a big word out there, but if you're on a drug, I want all the diabetics to go to their cabinets right now and pull out their medicines. And I want you to look at your medicines. If you're on a drug that's glimepiride or glyburide, they're generic, so I'm not going to have anyone come after me. Mm-hmm. Well, maybe. But anyway, listen, if you're on these drugs, these are drugs that do lower your hemoglobin A1C, which is the blood test that we use to manage your diabetes. And unfortunately, there's this national campaign of Know Your A1C, and unfortunately, we already talked about it. It doesn't matter. You can have a good A1C. If you're not managing your insulin resistance, you're not reducing your vascular inflammation from insulin resistance. So back to these drugs. These drugs lower your A1C, but do not lower your insulin resistance. There are many drugs out there now that are better at lowering insulin resistance, but these sulfonylurea drugs damage your pancreas further and put you on a course to needing insulin faster. If you're on one of these, you've got to really question your doctor and go, why are you putting me on this poison? You're going to make me need insulin quicker. And they should be off the market. They're bad drugs. The only reason people are using them.
Why are they on the market if they shouldn't be on the market?
Because they're cheap.
Who cares?
Who cares? Your insurance company, the government, Medicare, your Medicare Advantage program, they all are driving you to less expensive drugs. And the only time I use these drugs, if someone cannot take anything else because they just can't afford anything else, but I really hate when I have to do that. I try everything I can not to use these drugs. So there's another way to get rid of insulin resistance. Again, we talked about not eating food. In my practice, I'm saying not eating food that causes your body to have insulin resistance. In my practice, we take the time to counsel people on proper lifestyle and using the right medicines when needed. Again, I don't use medicines unless someone has vascular disease, because I don't want to give someone a drug for a problem they don't have. The goal of treating diabetes is to prevent a heart attack or stroke. That's why we're treating diabetes. The goal of cholesterol is not to lower your cholesterol. We're using cholesterol drugs to prevent heart attacks and strokes. That's what the goal is. The goal is not to have a good cholesterol number or a good A1C. The goal is to not have a heart attack or stroke. So
wait, I want to ask you something. So do they have to take drugs to lower their cholesterol? Is that the only way out?
Well, statins are used to lower inflammation. I know there's a lot of people out there that are go, I'm not taking the statin, it's got problems, I looked it up online. We're gonna have a show about that. So about why we need statins. But statins are great at lowering inflammation. The most important thing though to lower inflammation is improve your lifestyle. So for free, without a drug, without needing to see a doctor, by eating better, exercising more, getting more sleep, basic things that don't cost you a penny, you can reduce your insulin resistance and reduce your risk for heart attack and stroke. It's the number one most important thing for you to do. Now, if you have vascular inflammation, again, by looking at the arteries, you got to see it with this carotid intima media thickness test, this CIMT, which we do in our office. I'm inviting everyone out there to call 248-737-0091 and we'll get a CIMT for you and see what your arteries are looking like. That's really our goal treatment, is to make that go away. We want your artery walls to be healthy. That's the goal of all this stuff, not to have a good cholesterol or a good A1C. We want to get A1C that measures diabetic care. We want to not have a heart attack or stroke. That's the goal. In the process of getting to the goal of not having a heart attack and stroke, we're going to also reduce other chronic diseases, because this inflammation that's generated by insulin resistance causes other things like Alzheimer's and dementia and cancer. There's plenty of studies that show people with a good lifestyle have less cancer. They have better outcomes for prostate cancer. They're starting to show better outcomes on breast cancer. People with great lifestyles can reduce their cardiomyopathy. So I want to give some talk about who I'm getting this information from. One of my mentors is Dr. Dean Ornish, who's been writing books and doing studies for decades, and that's kind of who I'm using as a mentor for lifestyle. He's done studies where they take a group of people who are on the heart failure list. They've got a heart failure, they need a heart transplant, and he put the people that wanted to be on his program on it, and by lifestyle changes alone, 3/4 of people on the heart transplant list came off of the transplant list. So people, don't underestimate the power of a proper lifestyle. And this is we're going to talk about this every show. This is the most important thing. Don't think, well, I can't do that. Make a choice to take the power of your health in your own hands. I made you all very frustrated about, what do I do because my doctor doesn't know what to do. Mm-hmm. Well, the power is in your hands to choose to live healthier, exercise a little more, eat a plant-based diet, and you are going to reverse your disease.
Yeah, that was the question I was going to ask. If you're already in trouble, is it reversible?
Absolutely. You're alive on this earth. It's never too late to start.
So they just need to get into a program.
They need to come see me.
You're right.
I'm the one to see.
Okay. Well, we're out of time, and that wraps it up for the Colander Medical Radio Show on News Talk 760 WJR, sponsored by Colander Medical and Bystander Response. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Colander for talking to us about taking charge of our health, being proactive, and avoiding both heart attack and stroke. For more information on today's show, or to learn more about Dr. Colander's practice, you can reach him directly at 248-737-0091. Again, that's 248-737-0091. We hope you enjoyed the show and that you become more informed about avoiding heart attack, stroke, and the devastating results of artery disease. And more importantly, what can we do to halt or reverse the process? Once again, reach out to Dr. Colander at 248-737-0091. Thank you for listening.